Hi everyone, Dr. Bruce here. In this video, I'm going to cover some urinary system anatomy. Let's begin by going to my urinary system 3D interactive models page, and we're going to start looking at the entire urinary system with this model right here. So let's go ahead and get that in. So this is the whole urinary system. So not a lot of anatomy here, but there's a whole lot of physiology that occurs in this system. We're going to begin with the blood coming into the kidney. So blood goes into the kidney, blood comes out of the kidney, and urine comes out. The blood is brought in via the abdominal aorta, which branches into the renal artery, and then blood returns to the heart via the renal vein. Those are these two structures right here. This, of course, is the kidney. The kidney will make the urine from the blood, and then the urine drains via the ureter. That's this long tube right here to the bladder and then out via the urethra. So again, not a whole lot of anatomy. That's the gross anatomy of the urinary system. Let's look at the kidneys in a little more detail. So here's a kidney, and the outer portion of the kidney contains a tough fibrous membrane called the renal capsule. Now the kidney is divided into two major sections. The outer portion is called the cortex. The inner portion is called the medulla. The medulla contains these structures right here, these triangular shaped structures called pyramids, renal pyramids. And the pyramids contain microscopic structures called nephrons that actually make the urine. Between the pyramids are what are called renal columns. So there's a lot of circulation going on in there. The urine is made in the renal pyramids and drains through the nephron to what's called the renal papilla. That's this tip of this pyramid right here. So the filtrate drains from the renal papilla to what are called minor calyces. Those are these. These combine to form major calyces, and the major calyces combine to form the renal pelvis. So the urine flows from papilla to minor calyx to major calyx to renal pelvis, and then out via the ureter. All right, so that is the anatomy of the kidney. So let's look at the microscopic units called nephrons in the kidney. So let's take a look at this model. So these are the structures that make the urine from the blood. So the blood enters via this little arteriole called the afferent arteriole, and then it comes out via the efferent arteriole. Now, between the afferent and efferent arteriole is a cluster or group of capillaries called the glomerulus. This is part of the filter, and the first part of urine formation is filtration. So this occurs in the glomerulus. So the filter then produces a filtrate, which is captured by this tough fibrous capsule called the glomerular capsule. So the filtrate is captured by the glomerular capsule and then flows through these tubes. This first tube is called the proximal convoluted tubule, and it's surrounded by capillaries called peritubular capillaries. So there's a substance exchange that occurs between the capillaries and the tubule, and that's your tubular reabsorption and secretion. So the filtrate moves through the proximal convoluted tubule and then enters the nephron loop. So there are two parts of this. There's the descending limb right here, and then the ascending limb. And I have a separate video on how the nephron loop works. The nephron loop is also surrounded by capillaries. These are called the vasa recta. So the filtrate exits the nephron loop from the ascending limb and then travels via this twisted tube called the distal convoluted tubule. And the distal convoluted tubule is also surrounded by capillaries called peritubular capillaries. So once again, there is substance exchange. Your tubular reabsorption and tubular secretion occur between the distal convoluted tubule and the peritubular capillaries. So substances are moving back and forth between the tubules and the blood. Once the substance moves through the distal convoluted tubule, it ends up in the collecting duct. That's right here. There's also some substance exchange occurring here as well. And the collecting duct ends up at the renal papilla. All right, so hopefully this helps you understand some of the urinary anatomy. And hopefully, and feel free to use these 3D models at any time, and we'll see you in cyberspace.